Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown. I'm here with my normal co-host, Dr. Andrew Vallo. We have a really awesome subject today, one that I love, protecting your team. It's part of being a leader is protecting your team, not putting them at risk and making sure they're effective. I'm sure we're going to talk a little bit about dismissal letters and some other stuff in the middle of this episode. I first discovered dismissal letters a couple years ago to practice, and there was this lady losing her mind in the practice, like screaming and yelling and taking her phone out and videoing stuff. We had to lock her out of the office, and then she was in front of the office doing a Facebook Live, losing her mind. And we found out that she actually had dismissal letters from other practices from an assistant who worked in the practice who encountered her somewhere else in town before where she worked. So that lady's gotten dismissal letters everywhere all over town. And there's a point where you have to protect your team and have their back. It's really critical. They'll respect you as a leader. It builds human equity to them because it makes them feel like they matter. So, Dr. Vallo, I know you just had a scenario you just encountered. I'm curious what made you want to have this episode today, because you were pretty motivated about it.
Yeah. Hey guys, I think this will be an interesting topic today. So, I guess first of all, I want to mention customer experience, customer service. Those are one of my very highest priorities. That is how I've built my dental group. 5-star Google reviews, returning patients, referrals. So, 99% of the time, if a patient is unhappy about something, we are going to go out of our way to try to resolve the problem. We train our teams on effective apologies, not just saying I'm sorry, but actually, empathizing with them, finding a resolution, making the situation right. So this is key for me. And, I do everything I can to try to keep our patients happy, even in situations where I don't necessarily think we did anything wrong as a practice. I will often, kind of step down and just kind of, cut my losses there and try to help the patient out. There is an exception though, and that exception is when patients are unruly with my team members. So, as much as I want to protect our patient experience and as much as I want every patient to be happy, when I observe or hear recording phone calls of patients just absolutely going off on team members, that's something that I won't stand for. So we did have a situation recently. A patient was upset. Basically, long story short, it was an insurance matter. Patient did not provide their insurance in time, ended up getting a bill, and my team was actually working really hard to try to resolve this issue for this patient. But I honestly, I think we've had a couple situations in the last few days. I think people are a little bit on edge because of the hurricanes, and I understand that, and I understand people getting a little bit nippy or snotty or whatever it is, and that's fine. Again, I think most of my team has thick skin. They know that they're in the customer service industry, in the dental industry. And they don't take that personally. We talk about seeing patients at their worst because they're fearful and anxious. And so, my team is very good at de-escalating situations and kind of helping make patients comfortable. But there's a line, and there's a line that really should not be crossed. And so when I hear on the phone a patient screaming obscenities at one of my team members, making sexually explicit comments to them.
What?
Yeah, yeah. So
What?
yes, that's
This is really about respect.
yes. That is not gonna fly. So, anyways, this situation did happen recently. This patient then, went and left us a bad Google review. And my office manager asked if I wanted her to respond to the review and follow up with the patient. And I said no. I said I'm going to handle this one personally. So, this is one of those situations where, as much as we want patients, there are some patients that maybe just aren't the right fit for your practice, and it's okay to give them the opportunity to seek a better situation for them at another dental office. And that's exactly what's going to happen with this patient. So I am making it clear to this person that language like that is not acceptable and that, they are not welcome at our practice. Again, at the end of the day, as a dental office, we're supposed to offer emergency care for 30 days and all that. So we're going to go through the official, list, but I'm also going to let him know that if he would like to seek emergency care, it is an expectation that he's going to apologize to this team member for the language that he used with her. So guys, I think it is really, really important that you are aware and that you stand up for your team members in situations like this. Again, something to this extent is pretty rare. We have thousands and thousands of patients across our practices. I would say probably almost on a weekly basis. There's somebody who's frustrated about something and maybe isn't as nice as they could be. But I think it has to stay within a reasonable area of being respectful. And if those lines are crossed, and if your team members feel like they are being harassed, you've got to step in as the owner, and you've got to make decisions that are in the best interest of your team and protecting your team. Because honestly, if you don't stand up for your team and they face situations like that, they may not be working at your office much longer.
Well, it's part of, it's like, when you're in the military, like, leadership is an investment in others, right? When you have someone's back and you stand there and you shield them and you say, I'm not going to allow you to be exposed to this. They look at that and they go, man, this person, I'm not just an employee to them. Like, they care, right? And you guys are a team. Like, you have to think about this. Like, you guys spend more time together during the day than you spend waking hours at home at night with your families. Think about that. Like, think about that. Think about hard. Like, think about that really hard. Like, you probably come home at 6 or 7 o'clock at night. You put the kids to bed, do whatever it is you do. You spend 2 or 3 hours with your spouse every night. You spend 8 hours a day with these people under stress on the front lines of dentistry dealing with this crap. And dentistry is tough. And when you stand behind your team member and say, I'm not going to tolerate this, that energized. We had a client recently that was really rude to Callie, one of our account managers. And she was like, this guy said some stuff on the call that was not okay. It was actually similar. He was saying some stuff about like peeing and some crazy stuff, right? And I was like, I'll handle it. Get him on with me, or schedule a meeting and don't tell him I'm coming. I'll come handle it and you don't be there. And I just went and told him. I said, hey, man, your money's not good here. He was like, what? I was like, I'm not working with you, man. Done. I'm not exposing another team member to you ever again. Their sanity and their positivity during the day is too valuable to me. Like, you can ruin one of my account manager's days, and then they're not the best they can be for other clients, and you're not worth it, man. Sorry, doc. Later.
Well, I think it's just, you could see 40 patients in a day, and 39 of them could be great patients. And if you have one that's just out of control, an absolute nightmare, that one person can ruin the culture at the office for the entire day. I mean, it can impact everybody. Again, and like in this situation, I was actually at the office when this phone call had occurred, and I saw the team member who spoke to the patient who was nearly in tears. I saw the office manager who was consoling her and couldn't believe what had happened. Other team members saw all this going on. So again, it's just I think a toxic team member can be a cancer to your dental team, but so can a toxic patient. So you have to know when to cut ties. And I'm not. I think maybe there's some docs that take it to an extreme, and they only want to see their quote unquote ideal patient, and they maybe not formally dismissing with dismissal letters, but like basically, almost like unintentionally dismissing by not really trying to treat them or not offering them great options or whatever it is. So I am by no means recommending that. In my mind, our ideal patient is anybody with or without teeth. So, I mean, there's a very vast pool of ideal patients out there for us. The only qualification is they have to treat our teams with respect, So like that, this is not something that's happening on a weekly basis where we're dismissing patients left and right. I mean, I can probably count on one hand the number of patients we've dismissed this year between the practices. It is a rare occurrence, but when it does occur, you've got to handle it appropriately. So that was kind of my whole message today, guys, is just the from time to time these situations will occur, and especially if you hear the situation, if you're able to listen to a recorded phone call and it is very clear that the patient is in the wrong, you need to act appropriately there. You need to have your team's backs.
Part of what comes to mind is docs always want to call their practice their patient's dental home. They want to say like, I want dental home patients, or I want this to be their dental home, right? I think if you think about the mentality of, if somebody came in your house and disrespected your kids or your wife or someone else in your home, how would you handle it, right? You wouldn't be happy about it, and you would address it, and you would tell the person, if it continues, you're not welcome back in my home. Well, if your practice is truly a patient's dental home, then you need to protect that home and that environment like you would any other one. Because let's say the person's being disrespectful and saying crazy stuff in the waiting room at the front desk. There's patients sitting there that already have dental anxiety, and that negative energy is feeding that. And that could take three people in that waiting room and turn them into not accepting treatment, and has nothing to
Yeah.
do with you, right? Like, it's just because they're carrying their own negative emotions into the practice, and then that person's screaming at the front desk. You need
Yep.
to neutralize it and remove them immediately,
Yep.
and protect your dental home for all your other people that live in your home, right? You,
Absolutely.
you got to treat it the same. If you want to call it your dental home, think about this, doc listening, think about this. If somebody came into your home and disrespected your loved ones, how would you handle it? Protect your dental home. Don't allow this toxicity in. And if it starts to creep in, you got to kill it.
So what happens if you're in the middle of treatment on a patient who is acting this way? So like let's say hypothetically, and that wasn't the case with this patient. We actually had not started any treatment with them, thankfully. But let's say that you're in the middle of a large veneer case, and you've done the preps and you're trying to get the permanent seated, and maybe the patient's not happy with the shade or something like that, and all of a sudden they start to turn into this unruly patient, and they're screaming at your team, and they're yelling obscenities, and they're making people feel uncomfortable. That's a tougher situation, because obviously you can't abandon somebody in the middle of treatment. So you've got to kind of figure out, what is the best approach here. My suggestion would be, first and foremost, you should have a kind of sit down, coming to Jesus conversation with that patient. And you should have somebody present with you for that conversation. Ideally maybe the office manager, but you guys should sit down and, basically let the patient know, hey, you trusted me with your dental care. I want to help you get across the finish line. I want to, give you the smile that you want and deserve. However, in order to do that, I'm going to need you to treat my team with respect. So, the yelling, the obscenities, like that needs to stop. Unfortunately, if you are not able to treat my team with respect, I may not be able to finish your smile makeover, and we may have to find another dentist to do that. So I think that's the first step. I think you need to have that serious conversation. And
You should find another dentist to do it. Inside your group, would you ask another dentist in the group to do it, or would you remove them from the group totally? So in this scenario, would you make a change of personality maybe and have a different doc deal with them? How just because docs are thinking that in their head, like, do I change and tell them to go to a different dentist outside my practice or my group, or do I like let my associate finish it or someone else? Like, just explain that real quick, 'cause I think
I
it's
think
worth thinking
that's a
about that.
different scenario, and that does happen, Matt. But that doesn't happen when a patient is just being
Okay,
unruly and
that's what I asked.
right. So there have been times where one associate is having trouble pleasing a patient, with the cosmetics of something, and we've basically referred them to another associate within our group. And the way we normally handle that, we try to make it fair to everybody. So the associate who started the treatment, they give up half of the production that they had originally gotten, and the associate who finishes treatment gets half the production. So we kind of split it half and half, and everyone knows that sometimes you might be the one giving up half, sometimes you might be the one getting half. But I think it's a fair situation, and it keeps everybody happy. So that does happen, and sometimes sometimes these patients have gotten frustrated But again, there's a certain line, and they haven't crossed that line to the point where they are making our whole team feel uncomfortable, disrespected, unsafe, whatever it is. In a situation like that, like we were just talking about, if the patient gets to the point where your team does not feel safe working with them, does not feel comfortable, feels completely disrespected, you're hearing loud yelling and cursing and all that stuff going on, that's where you need to have that conversation and basically let them know you're going to have to refer them outside your group if this behavior doesn't stop. I think it's important to at least have that conversation first. And honestly, you'd be surprised. Sometimes you have that conversation and patients start to backtrack pretty quickly. I'm sorry. I'm frustrated. This is taking longer than I thought, blah, blah, blah. So hopefully you have that conversation, your expectations are made clear, and you can move forward with that patient-doctor relationship to finish the treatment that you started. However, if you have that conversation and the patient is unable to kind of uphold their end of the bargain and that behavior continues, at that point in time, I do think you seriously need to look at trying to refer them outside to finish their treatment. Again, that's tricky. You don't want to leave a patient abandoned in the middle of treatment, but I think it's important you take very good notes. I think it's important that you have witnesses to these situations, document the behavior and everything that's going on. But at the end of the day, if the patient is making the team feel unsafe, I do think it's warranted to, refer them out mid-treatment to try to have it completed somewhere else.
So we're gonna wrap this up real quick. It's funny. I thought it was something we were doing this. I have a friend of mine, and she's crazy, and she has kids, and she's crazy. And they were going to a local pediatric practice here in town, and they got a dismissal letter. And she came to me. She goes, "Is this a thing? Like they're telling me they're breaking up with me?" And I was like, "Yeah." And me and my wife talked afterwards, and she's like, "I believe that was her." I was like, "Oh yeah, I believe it. I know the woman personally, right? Like I know
Yeah.
like if anything doesn't go her way, she loses her mind,
Yep.
right?"
Yep.
And she like came to me with a dismissal letter. I know her personally. She was like, "I know you work in dental. Is this a thing? Like, can a practice break up with you?" And I was like, "Yeah, they can." He said, "Well, what do I do now?" I'm like, "You gotta go find another pediatric dentist." So, well, my daughter loved that dentist. I was like, "Maybe you shouldn't have acted that way. There's a consequence. Like, you don't have to help everybody, right?"
Yep.
And it was funny when it happened. My wife, it was my first time my wife ever heard about dismissal letters, and she was like, "That's a thing, huh?" I was like, "Oh, it's a great thing. It's a tool that's there for the right reasons." And I totally believe that person definitely got the dismissal letter and should have, because I know her personally. But hey guys, we're gonna wrap up this episode. It was really awesome. It's a really touchy episode. But you have to protect your team. You spend all day with them. You have to protect your dental home. You have to maintain that really good, positive mental environment where there aren't negative emotions, because patients already bring in their own negative anxieties, and these toxic patients will sour that and they will taint it. And you need to maintain that awesome environment. And Dr. Vallo put some really good pearls in there. Thank you guys so much. Please hit like, subscribe, and leave reviews, and please share the podcast. Thank you guys. Have a great day.
Thanks, guys.